everybody, to the Laughter Through Tears podcast. I have to always stop myself because I recently renamed it Laughter Through Tears, was calling it the 120 podcast. Now I just call it Laughter Through Tears, the 120, or something like that anyway. But Laughter Through Tears is basically the summation of my life, my experiences with chronic health issues, life-threatening situations. There were times that I cried, and I cried a lot. And then there were also times that I laughed a lot, and I tend to default to laughter. It kind of helps me get through the tears. Anyway, I'm your host, Jackie Duda. I'm excited to welcome all of you back for what is going to be, I believe, the 24th episode, which we now have 24 full episodes on YouTube on this channel. And I am a septic shock survivor. Almost 5 years ago now, I survived colon perforation from undiagnosed diverticulitis. I was flown to Baltimore to shock trauma. They literally put me back together. I also have chronic conditions, Crohn's disease, osteoporosis, hypermobile Ehlers-Danlos, and POTS. My plate is very full, as are many in our chronic illness community. And one of the things I'm really excited today, my guest is Tré LaRosa, and I actually met him through my advocacy work with the Bone Health and Osteoporosis Foundation and the foundations of the National Institutes of Health. Last fall, I finally got to meet him in person, and, I'm a patient ambassador for both of those wonderful foundations. And, it's just been wonderful working with Tré. And then I learned that Tré has cystic fibrosis, which is kind of ironic because in the year following my sepsis survival, when I survived septic shock, I had lung damage. And in my train of thought that year, I was terrified. I had PTSD, and I was convinced I was going to die, and it was going to be my lungs that were going to take me out. And then I started sort of stalking the CF community on Instagram because those patients were inspiring me. And when Tré told me that he had CF, it was sort of like this full circle moment where, I realized that, there's a lot of people out here in the CF community, and like with all invisible disabilities, you would never know it. Tré LaRosa is the scientific project manager in metabolic disorders and patient engagement at the Foundations for the National Institutes of Health. He is also a patient advocate and a science and medical writer based in Washington, D.C., right here in the DMV, with a strong foundation in clinical research and a particular expertise in patient-reported outcomes and respiratory health communication. Tré serves as the Clinical Research Executive Committee, on the Clinical Research Executive Committee as part of the Cystic Fibrosis Therapeutic Development Network. And he writes a column for Cystic Fibrosis News Today titled Mutations Conversations. Did I get that right?
Yep.
Yep. And outside of work, Tré enjoys spending time. And my thing cut off. I'm so sorry. He enjoys spending time with his fiance, Jessica, their two dogs, Duncan and Leo. Oh my God, I love those names. Learning, reading, writing, and of course, spending time outdoors. Tré, I'm excited to have you here today. And right before we get started, I just want to remind our audience, a little bit of housekeeping here. This podcast is only intended for information and entertainment purposes only. If you have a medical condition, you suspect you have sepsis, you're having a medical emergency, don't rely on us. Please call 911 or call your own physician or go to your local emergency room. Anyway, with all that said, Tré, thank you so much for being here with me today.
Of course. Thank you, Jackie. I'm really excited to be here today. I'm excited to chat with you.
Yes, it's great. It's great having conversations. And like I said, cystic fibrosis has been something I've been wanting to learn a lot more about, other than just the lung involvement. So I was wondering if we could get right to it. And if you could tell me a little bit about your CF diagnosis, like how that all unfolded. And the way I understand it, that CF is genetic. And
That's right.
maybe you could help us understand that a little bit better.
Yeah, CF is a genetic disease. So it has what's called a traditional recessive Mendelian inheritance pattern, which means both parents have to be what are called carriers for the mutation. And so for me, I often say that cystic fibrosis is generational. Both myself and my sister Alyssa, who tragically passed away in 2018, she was only 29 years old. We both have cystic fibrosis, and for my parents, or for at least for my father, this was not totally shocking for us to have cystic fibrosis because he also lost his sister, my Aunt Renee, to cystic fibrosis in 1978. So and she was only 12 years old. So CF has progressed a lot. When I was born in 94, my sister had already been diagnosed, so it was not surprising that I had CF, but my mom said that when she kissed my forehead, she knew immediately that I had cystic fibrosis, and they actually they used to kiss babies and be able to tell because people with cystic fibrosis tend to have saltier skin, which is because cystic fibrosis is a protein transport issue that leads to some excess sodium chloride on the skin. So that's the biological that part of this. But cystic fibrosis is predominantly a gastrointestinal and pulmonary disease. So for me, my diagnosis was I was 6 weeks old. So I don't ever have any memories from prior to being diagnosed with CF. They thought that I was likely to have cystic fibrosis at birth, and so they did what's called a sweat test when I was about 6 weeks old. And that sweat test looks at the salt in my sweat, and it was very elevated and elevated to the point that it was confirmed as a diagnosis. So for a CF diagnosis, you need to have an elevated sweat and a confirmed mutation. So there's a genetic component that needs to be confirmed to get technically a confirmed diagnosis of cystic fibrosis.
And
Yeah,
both parents carry the gene, right?
that's right. That's right.
Like a recessive or
Yes, right. So both parents carry the gene, and then there's only about a 1 in 4 chance of any baby from two carriers having CF. So there's only about a 1 in 16 chance that both my sister and I would have it, and we both, of course, did. And I can talk more about my sister Alyssa. If you don't mind, she was. I say that her and I were both at the opposite ends of normal for CF. So we both had very prototypical CF. We both had the pulmonary manifestations. We had pancreatic manifestations. So one of the biggest challenges with cystic fibrosis is that our pancreas is damaged enough that it doesn't produce the basic enzymes needed to break down food. So a lot of us struggle with nutritional deficiencies, and a lot of babies struggle and have failure to thrive. So a lot of people with CF are pretty underweight. And so I actually had pancreatic insufficiency, but I didn't struggle with my weight. Whereas my sister she was chronically underweight her entire life, always a very low BMI. And so she really struggled with her weight. And she was a lot sicker than I was growing up.
I'm so sorry you lost your
Yeah,
sister. I mean,
thank you.
that's so hard to lose a sibling and for your
Yeah,
parents to lose their daughter. And
very difficult. Yeah,
yeah, I mean, and it just goes to show you that I think, no matter what the disorder, and with CF2, that it can be in the same family, but yet you and your sister were affected quite differently.
that's right. Very different. Yeah, that's right.
Wow. And like I said, looking at you when you told me you had CF, I never would have guessed. Again, it's one of
Yeah,
those, yeah,
yeah,
with you,
yeah,
it's more
that's right.
hidden for sure.
Exactly.
Yeah. And I mean, was your sister also diagnosed when she was a baby?
She was. So my sister, her birth story is really tragic. She had meconium ileus and was which is a very big indicator of CF. I think I don't quote me on this, but it's one of the biggest indicators of CF in babies, other than, of course, getting a confirmed diagnosis. And so my parents didn't see. They would have to give me the exact numbers on this, but I don't think that they were able to hold my sister for like 6 weeks after her birth because she was so ill and she had to have like a third of her colon removed at birth, and she almost didn't survive her first couple weeks of infancy. So she was very, very ill at birth, and throughout her life, she just unfortunately she was hospitalized every couple months almost throughout her entire life, hospitalized or on antibiotics, either oral or IV antibiotics throughout her entire life. She really struggled throughout. Now my sister was fierce. We have her and I both are quite passionate, but I would say our passion's a little bit a little bit different. Alyssa was fierce in other ways than I am, maybe.
Yeah. Yeah, the community truly is fierce. I've
It's a
met
great
some
community.
wonderful
Yeah.
people in that community.
Oh yeah.
They call it a rare disease.
Hmm.
Um, how how did they determine that? And like, do you know how many people in the US currently like have CF?
Yeah, so the usual number quoted for number of people in the United States that have cystic fibrosis is about 40,000, which is kind of cool in that growing up we used to say the number 30,000, but now people with CF are one, we're getting better at diagnosing it. For most people, there's one common mutation called the delta F508 mutation, which is the mutation I have on both chromosomes. I have two copies of this mutation. It's the most common, but there are a lot of mutations that are less common and historically did not get caught through screening. So we're getting a lot better at diagnosing CF, so that's a positive. And also people with CF are living a lot longer. So the number that's typically quoted in 2026 is 40,000. I believe the NIH and FDA consider rare disease to be fewer than 100,000 people within the United States. I think that's typically the
That
number
sounds
that's,
about right.
I think that's typically the number. So CF is it's usually not, it's usually stated to be the most common rare disease. So even though it's a rare disease, it's usually, I'm going to guess a lot of people that are going to listen to this either know somebody with CF or know of somebody with CF or at least have heard of CF. And a lot of rare diseases, that's not the case. A lot of rare diseases affect, in some cases, dozens of people, maybe a couple thousand. So CF is uh, quite common compared to other rare diseases, but it's still very rare.
Right. Yeah.
Yeah.
Yeah. I mean, I think you have a small but mighty
Oh
community.
yeah. Yeah. I
Just
agree.
with the vocal voices that I see on
I agree.
social media,
Hmm.
and US and Canada both,
Absolutely.
seeing patients there. And so I'm 63, and there was a girl I knew when I was in high school. I didn't know her directly, but she was like a friend of a friend
Right.
who had cystic fibrosis. I think that's the first time I ever heard of it. And
Yeah.
she did die in her late teens. So,
Hmm.
and that was common for the time. It was
Oh yeah.
like if you got that diagnosis, it was hard to live into early adulthood. So they have
That's right.
made progress,
Oh yeah.
obviously.
Yeah.
Um, when what is it like, and why do they call it cystic fibrosis? I know what the fibrosis part means, so
Yeah. So it's actually interesting because the name originated in the 50s, and actually a pathologist named cystic fibrosis. Her name was Dorothy Anderson in the 50s, because unfortunately um, she saw a lot of unfortunately young children who died from CF. So I believe it was originally due to the her the autopsies performed and the identification in the pancreas. But I don't know exactly where the cystic comes from because it's not, it doesn't, the name itself, the fibrosis is very common in the lungs, of course, but I'm not really sure where the cystic comes from, to be honest. I
yeah,
should
and
know that.
yeah, and the fibrosis part, because I've heard, there's a lot of things. I even see it as I age. I see fibrosis or
Hmm.
something
Oh
on
yeah.
my
Oh yeah. Yeah.
on X-rays and reports. It's sort of like a toughening or a hardening. Is that
That's right.
correct? What
I,
that
I
means?
mean, it may be an oversimplification, but I think of fibrosis as really the buildup of scar tissue that happens over time through the either so in CF, the big pathways that cause a lot of issues with the lungs in particular, and really any organ that's affected by CF, which uh, since I'm sorry, the CF gene, the gene that causes CF, It's called the cystic fibrosis transmembrane conductance regulator gene, and it's the protein itself that is expressed on the cellular surface. So it's anywhere that there's a mucosal lining, cystic fibrosis can have an impact. So for me, it affects my lungs, it affects my pancreas, it affects my gastrointestinal tract, even my sinuses. Growing up, I used to have a lot of sinus issues, but um, the I just lost my train of thought. What was your original question? It was about
Oh, yeah, the fibrosis being like a
right,
stiffening
right.
or
So
toughening. Yeah.
right. And so with cystic fibrosis, you get this really excessively thick mucus anywhere that there are mucus linings. So predominantly in the lungs is really where a lot of people's quality of life is dramatically affected. And just as a caveat, I want to express that the cystic fibrosis population is very heterogeneous, and a lot of people have different clinical manifestations and different presentations of the disease. So it doesn't look the same for everybody, but there are some common traits that a lot of people with CF struggle with, such as a lot of pulmonary infections. That's a huge issue for people with CF. The thick mucus in our lungs is an environment that's particularly rife for bacterial growth and development, and so you can have these colonies that form, and these prolonged infections really cause a lot of challenges for cystic fibrosis. And then you also have inflammation, so you always have this balance of the immune system's response to the presence of infections, in particular in cystic fibrosis. And so you're sort of balancing this, trying to kill infection without trying to have this regular inflammation that can also cause issues. That's what can be a big challenge for a lot of people with autoimmune diseases. You have an overactive immune system, which can wreak havoc in other ways. And so in cystic fibrosis, over time, you get these chronic lung infections that eventually just degrade the airways over time. And so we do what's called a pulmonary function test, or specifically spirometry, and we have to inhale air and then blow out in a second, and it's called FEV1 is the marker, forced expiratory volume in the first second, and that's effectively measuring our lung function, or really just measuring how much air we can hold. And I think of it as how much air we can access, because if you're not able to get that air out within a second or two, it's probably not air that you're really accessing as much. And respiratory therapists would probably correct how I explain that. But that's how I think of it, because I really think of CF as affecting the large and small airways, but over time it starts to affect both, and that's where a lot of the pulmonary disease can lead to some serious challenges. That's why a lot of people get lung transplants.
Right, right. And when you're talking about spirometry, you talking about that thing in the booth, because I just had that done last week too.
That's right.
It's like,
Yeah, that's right.
I hate that test.
It's not fun. It's not fun.
It's awful.
I used to have a headache afterwards, because this gets a little bit in the nuances of pulmonary function tests, but you need, for them to be accepted in a medical context or a clinical context, you need them to be reproducible and acceptable. And the acceptable means that the patient performed it correctly, and so there's some criteria for that. And then the repeatable means that it's not an outlier. But growing up, I figured out that of course effort plays a big role, because you actually have to inhale and then blow out as hard as you can. And so I found out that I could push myself to give more effort. I used to end up with a headache because I would do so many, because I was trying to compete with myself. For me, it was a number that I wanted to see go up. It was, reflective of my health, and maybe a conversation for another day, but that was something that growing up affected me a lot, to have this number that was supposed to reflect my health, that sometimes it aligned with how I felt, and then sometimes it didn't.
You wanted to hit your PR.
Exactly. That's exactly right. That's
You wanted to
exactly right.
surpass it.
I always wanted to hit my personal record. Exactly. Yeah.
Oh my gosh. Yeah. The part of it I really hated was where she goes, I'm going to shut down your airway now. And I'm
Yeah.
like,
Oh
no.
gosh, it's such an uncomfortable feeling. Yep.
Like that little puffing, I couldn't do it.
It's
We
uncomfortable.
did
It
that like
really is.
5 times.
Yeah. It's a I've done hundreds of them over the years, but it's definitely an unusual experience for sure.
It is. And it's definitely something your lungs are going, wait. Where's the air?
Uh-huh.
Oh
Exactly.
my God. Well, we've already started to dive a little bit deeper into
Yeah,
what it's like living with cystic
right.
fibrosis. I mean, can you enlighten us a little bit more? Like I've seen some patients on social media, they have large pill cases.
Oh
They have
yeah.
to take
Yep.
pills for the pancreatic enzymes and
That's right.
uh, antibiotics a lot of times too. Is that it?
Yeah.
Like, is it a lot of pill taking or?
Yeah. So I will start with acknowledging one major change that's happened in my life and a lot of other people with CF. In the year 2019, late 2019, a new medication called Trikafta was approved for a large proportion of people with CF. And this is a part of a drug class called CFTR modulators, meaning it actually addresses the underlying cause of a lot of the issues with CF. Historically speaking, most medications and treatments have been symptomatic therapies, so something to either help combat infection or help gain weight or what have you. But 2019 marked a major inflection point in the CF world because it actually gave a lot of us access to a medication that had profound benefits. So I'll sort of give an answer on the before, what my life looked like, and then what my life has looked like since. But growing up, I had to do a lot of things just to manage my health. And it honestly felt a little bit like, at times, it kind of felt like um, just trying to stifle a really advancing disease because CF is progressive, and for a lot of people, it's pretty aggressively progressive. But for me, growing up, I used to have to do what's called chest physiotherapy, and growing up, that looked like my parents would cup their hands and literally do this on the different lobes of my body. And sometimes they do chest physiotherapy in the hospital for a lot of different things if patients are admitted for prolonged periods of time. But for CF, the goal was to actually physically and mechanically break up the thick mucus in the lungs. So the goal was to actually help produce sputum after the fact. So after these treatments, as we called them, or chest physiotherapy, the goal would be for the patient to do what's called huff calls, where you would actually have to sort of do what we just described with spirometry, where you have to like try to actually get air underneath the sputum to try to get it out because it was so thick and so obstructive that you actually were trying to get some of this out. Which goes to show you just how, at times, rudimentary care with cystic fibrosis has looked. Because it's like you're just trying to do whatever you can to try to give the people with CF any chance they can have to either beat these infections or just free up some airway space to actually breathe. So that was a big part of my life, and those would take 1 to 2 hours a day. If I wasn't feeling well, I'm sorry, 1 to 2 hours twice a day. So some days I was looking at 2 to 3 hours of chest physiotherapy. And growing up, it was a big part of my mornings and evenings. My parents would do it before school, and um, kids with CF are heavily advised to be active because physical activity is another way to really get help address the sputum in the lungs, mucus in the lungs. In addition to that, I've been on a lot of medications throughout my life. Uh, I've been on chronic antibiotics. I've been on chronic anti-inflammatories. For example, I've been on azithromycin for decades as a way to help sort of keep the excess inflammation at bay. I've been on what are called pancreatic enzymes, and these are to help actually provide the enzymes I need to break down food and help gain weight. I've been on IV antibiotics a lot throughout my life. I used to have to do several inhaled therapies. So I used to do albuterol, which is a bronchodilator, which would help actually open the airways. And then I would do a medication called Pulmozyme. And then I would do this Pulmozyme it's called DNase, and it would help break up the mucus. Actually, it helps you inhale it and it helps chop up the mucus. It chops up fragments within the mucus. And then in addition to that, I'd have to do one called hypertonic saline, which actually has a cool story. So I'm going to give a quick background
Yeah.
on this. Hypertonic saline is literally just salt water. Just inhale salt water. And it became a common medication in CF because in Australia, some researchers or clinicians or I don't know exactly who, but identified that people on the coast actually people with CF on the coast fared better than people further from the coast, and they found that the salt in the air actually really helped to restore some of the salt in the lungs and actually help improve mucociliary clearance is what it's called, and actually help thin out the mucus and help clear the mucus out. So it's a pretty cool story about how some things can sort of arise. And then I used to have to do inhaled antibiotics all the time. So I was on chronic inhaled antibiotics in addition to everything else. Um, and then I've
Lots of
also been on
antibiotics.
supplementary vitamins and
Yeah.
things like that as well.
The thing about the ocean, that's amazing
It's
because
really,
I love
yeah,
the ocean. I mean,
I do
a
too.
lot of
Yeah,
us do. So it's
yeah,
sort of like head for the coast. I
yeah, yeah,
typically, and I don't have CF, but if I go to the ocean, I feel better. A lot of us,
yeah, oh yeah.
yeah.
I think there's the element, of course, of the fresh air, but I think in general, I mean, a lot of people do um, like different like nasal, inhaled nasal and inhaled hypertonic saline for a lot of different reasons. So it's got a lot of benefits. So I think that a lot of us probably just stand to benefit from that type of thing.
So management for a CF patient, first of all, sounds like it requires a lot of time.
It does. Yep.
Well, when you were younger to do the chest palpitations
That's
and to
right.
get the mucus broken up and then of course a lot of medication management too,
Yep.
and a
Yep.
lot of
Love.
antibiotics and anti-inflammatories and all of that. So,
Yeah. A lot of
and so that
medications.
was before Trikafta. Is Trikafta a pill? Is it an infusion? What
It's
is
a
it?
pill. It's
It's a
just a
pill.
pill. It's super, super pill. I mean, it's two pills in the morning and then one pill at night. So, Trikafta is what's called a triple combination therapy. So there's actually three compounds in Trikafta, and so that's why it's dosed a little bit uniquely in that there are two in the morning and one at night. But yeah, so it's a super simple medication. And since I've been on Trikafta, I've been very fortunate to profoundly benefit. So my lung function, which before Trikafta had started to decrease into the mid to low 80s, which is still considered very healthy for how old I was, but I was starting to notice decline, and that was decline despite all the things I had to do just to try to maintain a slight decline. So prior to Trikafta, I often felt that everything I was doing was just trying to reduce the curve, if that makes sense. So just try to reduce the slope and try to reduce the decline. It was no incline. It was always just, reducing the decline. But then I started on Trikafta, and I have had an extremely positive benefit. My lung functions remain stable the last 7 years. I no longer have the excessively thick mucus that I used to have. I don't have to do the inhaled therapies that I used to have to do. Um, and I haven't been on IV antibiotics in almost a decade. So I've
Wow.
had a fantastic benefit. And, of course, with every medication, there are adverse effects. And in my case, they've been fairly minimal. Some people have some liver challenges, and some people seem to have some additional unfortunate, like psychiatric issues with mental health and anxiety and depression, and which is a profound issue in rare and chronic diseases in general. So it's some people have unfortunately also experienced increased issues with that, but overall, my experience has been profoundly positive. I mean, my life, I didn't think I would live to 30, and I turned 32 in a month, and am engaged and will be married in 3 months, and
That's
hope to have children and
exciting.
have a lot of yeah. It's been a very, very, very fortunate experience for me.
That's truly that's like a 180 from
It is.
as you
It is.
described. I'm glad you described it that way, life before Trikafta and life
Hmm.
after it. And
Yeah.
Trikafta appears to go after the source
Yeah. So
rather than the band-aid of the
right.
symptoms.
Right. So it actually improves like the basic way I think about it is actually improves the or it reduces the thickness of the mucus. I mean, I'm sure it does more at a biological level, but ultimately that's what I see. Instead of having this thick mucus that I'm inhaling medication trying to address, it
Yeah.
actually prevents the thick mucus from being such a profound issue. So it actually works upstream. It's the first therapy that I've ever been on that doesn't just try to address any of the symptoms or complications of CF.
Wow, that is truly amazing. And like I
Yes.
was mentioning earlier, the CF community, for a disease that only affects like 40,000 people in the US, when we have billions in the US,
Yeah. Yeah.
you have all built this very strong and mighty community.
Yep.
There's
Yep.
like I noticed the encouragement when someone is going through another lung transplant, for example, and the
Right.
encouragement from people in the community, and I mean everybody. I mean it's incredible. Why do you think that might be? Like how did you guys gather yourselves to, form this type of a bond?
Yeah, I mean, the CF community and the CF world definitely punches above its weight. And before I answer your question directly, I often tell, I used to, this is my prior life, I was a bench scientist in a CF lab. And what always astounded me is the number of people that are treating CF or researching CF or just involved in CF in some capacity outnumbers the people with CF, which is a fantastic, I mean, it's an incredible realization as somebody living with this disease that there are so many people that either are not affected by it personally or are personally affected by it but don't have it, that have invested their lives and their careers and their resources and have fundraised or donated money to try to build a better world for me and other people with CF. And so just a huge testament to the way community is necessary to really advance and progress outcomes. For the CF community ourselves, I mean, I think that the more that I've worked in other spaces, the more grateful in a sort of weird way I am to have CF, in that I'm a part of a long line of really, really smart, brilliant, prescient people. The Cystic Fibrosis Foundation was started within like a decade, I believe, of the disease being named, which is
It's
shocking to
incredible.
think back to the 50s and 60s. And so you have this band of parents who were really refused to accept that this is the way it had to be for generations into the future. And so I don't want to speak to the exacts, but the Cystic Fibrosis Foundation was founded in the 50s or 60s, and they started a patient registry around that time, which like there are diseases where there's millions of dollars in capital or hundreds of millions of dollars that don't even have these extensive patient registries, which are really, really profound tools that can be really, really helpful to identifying challenges or identifying solutions. And so the fact that they were that prescient so many decades ago is such a good example to me of how this community has been just at the forefront of a lot of things throughout history. And so I personally think that a lot of us people with CF have sort of been born into this world that has just a long, long history of people that have really, it's almost this culture of uh, fighting and believing a better world's possible. So I really think hope has been a huge aspect to progress in the CF world. And I'll also share that I mentioned that my great or my aunt, my late aunt, who died in the 70s, my grandmother was fundraising for CF in the 70s and 60s. And so my family, I'm very grateful for the family that I come from, because they have also been, fundraising and advocating for people with CF for a long time. So I think these are I think these are a big part of why the CF community has so much tenacity. And then I'll also say that historically, most of the advocacy was parents of people with CF, because kids with CF didn't live long enough to become researchers and scientists and adult advocates. And over the last couple decades, we've seen a generation of people with CF grow up in this world where we've had people advocating for us, but because we're so engaged in our care most often, because we see our clinicians every 3 to 4 months, I also think that's a big part of it as well. Is that for me, some of my first memories are having conversations with my clinician and trying to understand this disease that frankly didn't make a whole lot of sense, that I didn't choose. Not that most people don't choose to ever have a condition that they have. But as a kid, it's also very hard to try to reconcile this worldview when you see all these
Yeah.
other people who don't have anything, and then you feel like you're different. And so for me growing up, I think that was a big part of it as well.
I think you nailed it right there at the end too, with, being a child and growing up and seeing your friends running and playing, and they don't have to go to
Yeah.
the doctors as often.
Yep.
And they don't have to take all these pills. They don't have to do the chest there, the respiratory therapy.
Exactly.
Um, and, I can't imagine what that is like. And
Right.
I was smiling as you were describing the tenacity of the CF community, because I realized this little light bulb went off that, um, sadly and tragically, this is something where a lot of you get diagnosed when you're babies and you're infants, and
Yeah.
especially 30, 40 years ago, when those babies and infants couldn't even grow up, there's nothing a parent won't do to
Right.
try to save their child.
Exactly.
And these
Yeah.
parents, I gotta take my hat off to all of
Oh
them,
yeah. Yep.
because I'm sure they were, in the early days, especially, they had to be some of the most ferocious advocates out there. And,
Exactly. Yeah.
trying to advocate for their children, and to get, and that, I think, also, the more pressure that groups can put on, um, communities, like scientific communities, research and legislative, then you get movement, actual movement, and
Exactly.
thankfully and wonderfully so, CF, as you said, I didn't know that you had so many researchers. I knew there was a lot of research
Yeah.
around
There.
it. And again, when I was a child, I do remember, like when I was in my teens, seeing PSAs done by the
Yeah.
Cystic Fibrosis Association.
Yeah.
So it's
Yeah.
like, well, I do remember that. I remember that name.
Yeah.
I remember the name of the disease from way back then. So
Yeah. Yeah.
kudos to everybody, and your grandmother and
Yeah.
everyone who championed this effort to build this community as strong as it is.
I agree. It's a fantastic, uh, hope-filled, but also active and engaged and action-oriented community that I think um, people have had to operate in this world of where the future is unknown. And so I think that's for any community, for anybody living with a chronic, a rare, any sort of condition, you're often operating in this world of uncertainty. And I think the CF community in particular has seen a lot of milestones, a lot of progress, a lot of disappointments. And I think you sort of have to steel yourself to the reality, which is that like the future is uncertain. And growing up for me, I had to grapple with this uncertainty and not knowing what was coming, and also try to figure out wherever I could possess agency within that battle. And I think that's where science and advocacy really became my outlets for myself.
Right, because you're a scientist yourself.
Correct. That's right.
Wow. And did you go into science because of having CF?
I did. I did. I originally grew up by middle school, I think it was. I wanted to be a clinician. I wanted to be a CF doctor, actually. I wanted to be a pulmonologist. Um, but by the time I got to college, I was studying chemistry, and that's actually mid to late college is when my health started to get a little bit less certain, and I started to see myself declining, and I could just tell I wasn't bouncing back from infections as quickly as I had previously. And I was going to go to med school. I was in my fourth year, and took the MCAT and was starting to think about applying to schools. But then was also kind of torn because I really loved science. So I was torn between medicine and science, and decided to take a gap year. And through just sort of serendipitous connections, I learned of an opportunity at the hospital that I had actually been taken care of as a child, Cincinnati Children's, and started working as a basic researcher there, as a student researcher, and then worked there for about 5 years, and fell in love with science and decided um, scientific project management was the right route for me, because I could uh, help facilitate science while also I love working with people. So collaborations and working with other people was something that really appealed to me. So uh, that's how I ended up in my current life.
You also write for the Cystic
I do.
Fibrosis News. Yeah,
Yeah, I
that's
do.
that's amazing. And that's exactly what we need because I'm always talking about patient to patient. Patients learn
Uh-huh.
best from other patients. We get inspired best by each other. And,
Right.
you know, it's just an amazing journey that you've had there.
Thank you. I
I
appreciate
swear
that.
it,
Appreciate that.
and to wind up in the science field, um, is a real
Thank you.
benefit. You're an asset definitely to the community.
I appreciate that.
Legislative wise, and I know, I want to talk a little bit too about AMR, which a lot of our
Hmm.
audience members might not understand what that is and why that specifically applies to the CF community. But in
Hmm.
legislation, because I did give a legislative talk a few years ago up on Capitol Hill, and Mary, I forget her last name, but I think she was like the president of the CF Foundation, and
I
she
think
was,
you're thinking of Mary Martinez, who heads up the DC
I,
chapter. Maybe
I think,
she's
yes.
she's the executive director at
That was
the
her,
DC
yes.
chapter.
And
Yeah, yeah.
she
Mary's
was there.
fantastic.
She was
Yeah,
an
yeah.
integral part of that meeting, and we were speaking to staffers about, the overuse of antibiotics and,
Yep.
really, and I know
Hmm.
in my work, I'm actually going back to the Hill to do some more work on Monday and Tuesday, and a lot of our legislators are focused and very concerned about antimicrobial resistance. You want to
Yeah.
tell our audience a little bit about that and how it applies to the CF community?
Yeah, so antimicrobial resistance is a really big issue because if you what it ultimately is that whenever you continuously treat pathogens, so the bacteria in CF, in the case of cystic fibrosis in either the sinuses where bacterial infections can be quite common, or the lungs, over time these bacteria are really, really good at evolving, and they eventually can develop a resistance to the antibiotics that are available. I'll actually share that growing up, every single time I went to the doctor, I would have to cough up mucus, and they would look at the mucus in the lab and actually test the available antibiotics against the pathogens in my lungs. And they would actually show me a report that would say either S, I, or R. S being sensitive, meaning that the medication killed the bacteria. I meaning intermediate, I believe is what it stands for, may work, and then R meaning resistant, means it doesn't work anymore. So growing up, I was very, very, very familiarized with the possibility of antimicrobial resistance because over time, when you're continuously using the same medications and you're not changing that up and you're not having other options or you're not developing these tools, pathogens get really good at evading it and get really good at persisting, which makes them more dangerous and uh, really can be popular, can affect anybody. It's not just people with CF. So in the CF space in particular, since we have these chronic, very virulent, or I'm sorry, very persistent and dangerous infections over time, it just degrades the lungs, and eventually these infections become too hard to wrangle, and antibiotics don't really do much anymore. So that's what happened with my sister. She developed enough of these colonies, and her lung function declined enough, and there's just no way to use any more medication. So that's when she had to get her first double lung transplant. And then double lung transplants don't solve everything for people with CF. They are fantastic for a lot of people, but they still carry a quite a bit of challenges. And so my sister had two double lung transplants, and between her first one and her last or second, she died about 5 years within the first one. So it was a good thing for her, but also caused a lot. It was you're just trading challenges in some cases, at least in my sister's case.
Right. Right, because there's always the possibility of organ rejection and
Exactly.
yeah,
That's right.
wow. She was truly a fighter though. I mean,
She was. Oh yeah. She was fantastic. Yeah, she was amazing. Yeah,
so with all of this, the antimicrobial resistance becomes a real challenge. And
it does.
the sepsis community is very concerned about it because that's how you treat sepsis. The
Right.
acute,
Exactly. Right.
life-threatening situation I was given vancomycin, levofloxacin,
Oh yeah.
and metronidazole. You've probably heard of all
Yep.
of those.
Yep.
Um, and vancomycin is very, woo, that stuff is really harsh.
I had a bad reaction to Vank
Yeah. Yeah,
when I
that's
was
what the
younger.
nurses called it, Vank. Gotta
Yep,
get the
yep. I had
Vank.
what's called red man syndrome, and it was splotchy, and it was not a good
Yeah,
experience. Yeah,
reddish. I think I had that like on my back. Like my
yeah, it's an
husband was like,
uncomfortable.
"What's going on?" It was the back of my arms too.
Yeah,
And he
yeah,
took a
uncomfortable.
photo and it was like I don't know, one of the nurses, she didn't say red man syndrome, but she said it might be due to the Vanc.
Hmm.
But you want these antibiotics to work because if they don't work, it doesn't matter what the doctors do. They can't
Right,
take
right,
care of your infection.
exactly.
And so we have, Sepsis Alliance and Sepsis, all the organizations have been very vocal about the problem with antimicrobial resistance. And maybe that's also why we see so many legislators who are specifically focusing
Yeah,
on that. Some who are
yep,
physicians themselves, and they know how bad AMR
yep.
is. AMR for short is and can be, especially if it
That's right.
takes over like the community. Um,
Exactly.
can you
Yeah.
tell us a little bit about your project poster that you shared at the biomarkers anniversary that unfortunately I didn't get to see?
Yeah. So I had a poster that highlighted a lot of how FNIH, Foundation for the National Institutes of Health, goes about patient engagement and what we mean by that. And ultimately, patient engagement at FNIH is sort of we call it fit for purpose, which means every project looks a little bit different because what you're asking people with lived experience and patient advocacy organizations to be involved in looks a little bit different. You'd ask a person with cystic fibrosis to give their opinion on a clinical trial a lot differently than you might ask them to give their perspective on something like a biomarker development project. And so I highlighted how our projects are very fit for purpose and how we highly, highly encourage early and active engagement with the community. It's really the only way to be patient centric is to be highly active as early as possible as you're developing projects, especially clinical trials. So just to note that a lot of times clinical trials will fail because they're not designed with the patients in mind, frankly. And not that they're not trying to help people living with the condition that they're developing medication in, but that you don't actually think about how you do the studies, for example. And so you don't think about the fact that people with CF, for example, have to do vest treatments and they have to do inhaled medications. So if there is a clinical trial, sometimes they have to bring that stuff in. And so like a lot of people might not be able to do that, or they might need to take time off. So if you're having conversations with patients throughout the clinical trial, you're developing the protocol, those type of insights will come up a lot earlier in the process, which means that instead of launching the clinical trial and then failing to actually enroll people, you would develop different solutions for it and work your way around those challenges earlier on. So the poster pretty much just highlighted a lot of our strategy with how we engage patients throughout project development.
That's so important. And I really
Absolutely.
like this. I like the way I see the tide has turned where, the researchers and physicians are asking patients like what they can do better
Right.
to design these trials or what would be more effective or easily accessible for the patients. I think that
Exactly.
collaboration, and I know FNIH is very supportive
Oh
of
yeah.
that environment of the, researcher patient kind of collaborative
Absolutely.
efforts. I think it's
Absolutely.
really going to be a benefit to patients everywhere.
Yeah, I totally agree. And in CF, for example, this kind of goes back to one of your earlier questions. CF has been, to be clear, the progress we've seen in CF is immensely related to how much hard work tens of thousands of people have put in to see that progress. We've also been quite fortunate in some ways, and I'll share a specific example. Is I mentioned that biomarker or that test spirometry and how FEV1, that marker, is used to assess lung function. that biomarker is responsive to if you go on a medication that's working for you, that biomarker will work. Like you'll see improvement within weeks in a lot of cases, which is such a short time period to actually see therapeutic benefit. Whereas other diseases, the best biomarkers available, you might not see progress for 6 to 12 months. So somebody has to be in a clinical trial for 6 to 12 months before you'd actually even be able to assess if the medication's working. Whereas in CF clinical trials, we've been able to have shorter timelines to look at the efficacy and safety of medications. And so that's an example of where a biomarker can be really, really helpful if a better alternative exists. And so if you're not talking with people throughout the process of developing or validating biomarkers or identifying them, you might not really know the lived experience of what someone's thinking about and dealing with when they go to their clinic and actually have conversations with their clinicians about their life and their physical health. So it's very important to have these conversations early and to trust that you don't always have to be using the technical jargon to understand or to have conversations. And I think that's somewhere that scientists and clinicians are getting a lot better at, frankly. But it's definitely been a challenge over the years. I know it was a challenge for me growing up, thinking I couldn't provide perspective if I didn't know all the medical jargon. But that's not the case.
100%. I've been a journalist since 2001. It's been 25 years now.
Yeah,
And I remember in the very beginning, I somehow fell into this natural course of writing about health issues and health
yeah,
topics. I got a few pieces printed in the Washington Post about my asthma and things like that. And what you just said, I was so intimidated in the beginning
yeah, yeah,
talking to doctors and having to transcribe this medical jargon and make it make sense for the common everyday reader like me. And but in those 25 years, a lot has changed with the relationship
yeah,
between our science community and the rest of us. And what I try to do also through this podcast, because I've had scientists on here as
yeah.
well, it's not hard to talk to a scientist. You're a
Right,
scientist. I mean, it's
right.
really not. You're a patient and a scientist,
Yeah.
and you're so approachable. The scientists are very approachable, and they're very good at breaking down the information. So that's why I keep having scientists come on the podcast.
So I'll actually share, Jackie, because I totally agree. What really got me, I've always liked writing. It was always something I enjoyed doing, and I wrote about a lot about my lived experience, just like with experiences like for either essays in school or what have you. But it was actually when I was working in the lab where we had pediatricians who were some of the principal investigators and they helped manage the lab, and then basic researchers, so the people on the bench side, and then PhDs, and sometimes, and then me being one of the bench researchers, but also being a patient, hearing all four people talk and hearing they were all saying the same thing in different, how I think of it is different, like almost like if you take like a magnifying glass, like different layers almost, like somebody would be at the very specific granular level, somebody would be more at the like individual level, and then somebody would be at like the community level, but everybody's talking about the same thing. And it was then that I actually realized that that's what got me to really start writing about CF more specifically, is I was realizing that I enjoyed being in the scientific environment. I enjoyed talking to clinicians and understanding their perspective. And then I enjoyed providing my perspective as somebody living with this disease, and crossing those boundaries, I think, has been something I've really enjoyed doing throughout my career, because that's where you start to actually identify issues, in my opinion, is when people take the time to try to understand what level that everybody's talking at, and then we start to have really productive discussions about especially about what issues are preventing progress in different areas, whether that's cystic fibrosis, asthma, COPD, fatty liver disease, anything.
Absolutely. And now I always say I know enough to sit down and talk, like at the
Right,
biomarkers event. I can sit
right,
down and talk to scientists and researchers, and I know just enough jargon to get by.
Yeah,
It's like you know
yeah,
just enough of a language that you go to France and you
yeah,
can ask, where's the restaurants? Where are the
exactly,
bathrooms? Where are the, and you
exactly,
could
yeah.
just get by. And that's what I do now.
When I was in Italy in 2023, by the like fifth or sixth day, I was in Calabria, which is not a southern Italy. It's actually where my family's a couple generations removed, but from. And I managed to get through an entire coffee order, and I didn't speak any English, and I was really proud of myself because it was like the one time I felt like I made my way. But it's exactly what you're saying. It's like I knew just
Yeah.
enough to have one one
Yes.
interaction where I could get through with it.
Yeah. Oh yeah. Yeah, it does. It's like whatever works. Now the future. I want to leave this podcast with you. The What's the future of CF? Where do you think it's heading? And what would you like listeners and viewers to know most about cystic fibrosis and how they can help the community?
So one thing I'll say in particular is I mentioned this medication Trikafta that came out in 2019. And prior to Trikafta, there was a medication called Orkambi that I was on that helped me, but it didn't help me to the degree Trikafta helped. And that period of time between Orkambi's approval and Trikafta's approval was, it felt precarious because Orkambi was helping me, but it didn't change my long-term prospects in the way that it was originally hoped, or that a lot of us originally hoped. But then Trikafta came out. And for my specific mutation, we didn't really know if there would be a medication that would be able to do what Trikafta ended up doing. And for about 15%, 15 to 20% of the CF population right now, they don't have access to a medication like Trikafta. So for many of them, their lives still look like what I described earlier in the daily hours and the hundreds of pills a week and the lung transplants and the precarious lung infections. Um, but there was this period of time where we didn't know if people with Delta F508, my mutation, would be able to see this profound benefit. And I feel very confident that the CF research community is one of the most developed and committed and profound in that it's got just such a strong development network that I'm quite confident that we're going to see, whether it's gene therapies, whether it's genetic editing tools, whether a lot of different possibilities, and improvements in symptomatic therapies as well. I'm confident that we're going to continue to see significant achievements and improvement for everybody with cystic fibrosis. And I'm confident we're going to see a cure in the next couple decades, hopefully sooner rather than later. There's going to be a lot of challenges with the cure, but I'm confident we're going to continue seeing significant achievements. And I mean, the fact that we have gene therapies in the pipeline is already a major milestone. It's something that we weren't even talking about, or we were talking about very philosophically and abstractly a decade ago. So that's one thing I think for the CF community. I also think we're going to continue seeing a lot more patient-led efforts and patient-led advocacy efforts, including on a legislative level. Especially right now, there's a lot of challenges with a lot of people with CF rely on Medicaid, for example, and there's a lot of challenges with accessing medications in Medicaid. And I think we're going to continue to see more profound progress in that space. Legislatively, I hope we see progress on bills that can support the development of improved anti-infectives and antibiotics. And I hope we see some progress on the Help Copays Act is one of the acts that is a big topic in the cystic fibrosis world because it would mandate that copay assistance programs, which are heavily relied on by people with CF, including myself, would be applied to deductibles. So that's another thing that I hope we'll see in the future.
That's big because
That
some
is big.
people's deductibles are, which puts a
Exactly.
lot of medications out of people's reach.
Exactly. So that's one of the big legislative acts that could have one of the highest impacts on people with CF. And ultimately, I think what I want people to leave with is that hope in itself is a very important resource. And I think that it's really important there's a lot of evidence that shows that with gratitude, that if you continue to focus on the things that you're grateful for and the positives in life, that your brain becomes more trained to see those things. And unfortunately, the reverse happens too with negatives. And this is by no means a message of toxic positivity, but it is about the fact that there's always some progress that is really, really meaningful. And it's that balance of hope and action that I think has driven a lot of progress in a lot of different areas. And it's where I see, it's where I find my reservoir of optimism in a lot of areas, is that I come back to this point about the fact that there are more people trying to make things better for people with CF than there are people with CF. And that is just an astounding thing to really think about. And so, yeah, that to me is what I really try to cling on to.
It's truly, yes. And yeah, I know. I mean, you can't just say, well, just think positive and
Right,
it'll be
right, yeah.
okay. But even if, like I said this to a doctor one time, I love to go into my doctor's offices and I love doctors with a sense of humor.
Oh yeah,
You
oh
gotta
yeah,
have, especially my
yeah,
gastroenterologist. I'm
yeah,
like, dude,
yeah.
if you don't have a sense of humor, we're not getting through that colonoscopy very well.
Right,
So,
right.
but seriously, I'm just like, I want to have a doctor who could literally look at me and give me what do they call it? Very, um, a terrible diagnosis, but still find the humor in it.
Yeah,
Because I've
yeah,
still got to find the humor in it. Because if I'm just going to walk around and like I did the first year after surviving sepsis, I'm just going to be, raining tears on everybody.
yeah.
I, I have to find the laughs. I got to find the laughs somewhere.
Yeah, and I mean, this has been a theme throughout my life of just trying to find the agency, right? And I think if you can find the things to be either hopeful for or grateful for, or the progress, it it's sort of self-regenerating, right? It's almost like the opposite of a vicious cycle, that if you can to find those things, it actually gives us more belief in our own agency, which I think is what fuels progress through that continuous cycle. And it's not easy. And that's why we need community. And that's another big part of this, is that's why things like this activity, cross communities and having conversations, and um, things like your podcast. So, I mean, I'm happy to be here and talk with you. I've really enjoyed this. It's always great to chat with you, Jackie.
Thank you so much, Trey. And it's been great having you here. I know we were
Thank
looking
you.
forward to this for a
Yeah.
while, so I'm
Oh,
glad
yeah.
we finally made it happen.
I know. Me
And
too.
and yes, there is a lot of cross pollination between the communities and the chronic
Yeah.
illnesses and everything. Because we help one community, we help the others too.
That's right.
There's
Yep.
always going to be
Exactly.
some discovery in CF that can also help other people, maybe with breathing issues, or
Absolutely.
you just it definitely
It
spreads
does.
the good vibes everywhere.
That's
And I
right.
like
That's
that.
right. Perfect way to end.
Yes, thank you. Thank you.
Of
Thanks
course.
again, Trey. And thank
Thank
you,
you.
audience, for listening in today and watching. We will
Thank
see
you.
you again for episode 25 very soon.